downloaded more than 4 million times. The more people use the app, the more powerful this tool will become. It's another way for each of us to do our part to protect our loved ones, our neighbors, and our fellow Canadians. Les augmentations de nouveaux cas exercent une énorme pression sur les hôpitaux et sur les travailleurs de la santé qui sont de plus en plus débordés. Ensemble, on a réussi à aplatir la courbe au printemps et on est capable de le faire à nouveau. D'autant plus que maintenant, on a encore plus d'outils à notre disposition. Mardi, la ministre Anand et la ministre Haidu ont annoncé une entente qui va nous permettre de nous procurer jusqu'à 20,5 millions de tests de dépistage rapide. De plus, 8 provinces sur 10, dont le Québec et l'île du Prince-Édouard, adhèrent maintenant à l'application gratuite Alerte COVID qui a été téléchargée plus de 4 millions de fois au pays. Plus il y a de gens qui s'en servent, plus l'outil sera efficace. C'est une façon pour nous tous de protéger nos proches, nos voisins et nos travailleurs de première ligne. Alors, je vous invite donc à télécharger l'application gratuitement dès maintenant. Our top priority is keeping Canadians safe as we support people through this storm. This morning, we received the news that 378,000 jobs were added to the economy in September as the unemployment rate continues to go down. This is good news for a lot of people, but we also know that there's still lots more work to be done. Earlier this week, Canadians could begin accessing the Canada Recovery Sickness Benefit and the Canada Recovery Caregiving Benefit for people who are not covered at work if they get COVID-19 or if a family member gets sick. Next week, applications will also open for the Canada Recovery Benefit, which is replacing CERB for those who can't access EI. At the same time, we're also looking at how else we can support businesses, as we outlined in the throne speech. Today, we are announcing new support for Canadian businesses so that they can keep workers on the job and get through the coming months. Deputy Prime Minister Freeland will provide more details, but here's the bottom line. Even if many businesses have now reopened, most are not back to full capacity, while many others are facing the uncertainty of a second wave. Our goal is to support Canadian employers and help businesses bridge to better times. That's why we are updating support for commercial rent and mortgage payments with the new Canada Emergency Rent Subsidy. This will provide support to businesses directly, not through landlords. For businesses who've seen a revenue drop, the new rent subsidy can support up to 65% of eligible expenses and up to 90% for businesses temporarily shut down by a mandatory second wave public health order. At the same time, we are extending the wage subsidy at a rate of up to 65% of eligible wages to December and expanding the Canada Emergency Business Account for those small businesses that need it, including with an additional $10,000 forgivable loan. We'll also work to target financial support directly to businesses that have temporarily shut down as a result of local public health directions. We know this second wave will be even harder for those who get hit. That's why our response needs to be targeted and effective. Small and large businesses create jobs, drive our economy, and make our communities stronger. Our government will continue to do whatever it takes to support them. Comme on l'a mentionné lors du discours du trône, notre gouvernement va continuer de soutenir les entreprises qui vivent des difficultés pendant cette crise. Ce matin, on a appris que 378 000 emplois ont été ajoutés à l'économie en septembre et que le taux de chômage continue à baisser. C'est une bonne nouvelle, mais il reste encore beaucoup de travail à faire. Même si beaucoup d'entreprises sont ouvertes à nouveau, la plupart ne fonctionnent pas encore à plein régime et d'autres s'inquiètent face à l'incertitude engendrée par la deuxième vague. Voilà pourquoi nous ajustons l'aide au loyer commercial en créant la nouvelle subvention d'urgence du Canada pour le loyer. Ce soutien ira directement aux entreprises qui ont perdu des revenus en raison de la crise. La subvention pourra atteindre jusqu'à 65 des dépenses éligibles et 90 pour les entreprises qui doivent être fermées temporairement suite à des décisions des autorités locales de la santé publique. Nous prolongeons aussi la subvention salariale, allant jusqu'à 65 des salaires éligibles jusqu'à décembre, et le compte d'urgence pour les entreprises canadiennes, entre autres, en ajoutant 10 000 $ de prêts à remboursement conditionnel pour des petites entreprises qui en ont besoin. Nous prévoyons du soutien financier ciblé pour venir en aide aux entreprises qui doivent fermer leurs portes temporairement pour combattre les éclosions. Nous savons que la deuxième vague sera encore plus difficile pour ceux qui seront touchés. Notre réponse se doit d'être ciblée et efficace. Pour plusieurs, l'Action de grâce est un moment de partager un bon repas entre famille et amis. Même si cette tradition est ébranlée cette année, il ne faut pas oublier qu'il y a aussi des Canadiens qui vivent en situation d'insécurité alimentaire sérieuse. Cette triste réalité a été accentuée par la pandémie. En avril, nous avions annoncé un investissement de 100 millions de dollars afin d'améliorer l'accès aux aliments pour les Canadiens les plus démunis. Aujourd'hui, j'annonce que nous verserons 100 millions de dollars supplémentaires à des organismes nationaux, régionaux et locaux qui viennent en aide à ceux qui ne mangent pas à leur faim. Ce montant sera versé par l'intermédiaire du Fonds d'urgence pour la sécurité alimentaire du gouvernement du Canada et la ministre Bibeau va pouvoir fournir de plus amples détails dans quelques instants. Ce matin, je me suis rendu à l'épicerie afin d'acheter des aliments pour les remettre à une banque alimentaire et on m'a rappelé quelques astuces pour ceux qui veulent faire des dons et je sais que vous êtes nombreux à penser aux autres cette fin de semaine de l'Action de grâce. Prioriser les aliments non périssables comme des conserves. Les aliments à préparer au four à micro-ondes sont plus faciles d'accès pour les gens qui n'ont pas de four. Et n'oubliez pas de faire des choix santé. Notre gouvernement continuera de soutenir les Canadiens pendant cette crise, surtout les plus vulnérables qui sont le plus durement touchés, mais j'encourage tout le monde de faire sa part. In April, we invested $100 million in emergency funding to help food banks and community organizations with their vital work. Today, I can announce that we're putting another $100 million towards supporting food banks, local food security organizations, Indigenous groups serving vulnerable people and communities, and partners for Northern communities. Last night, I had a video call with Food Banks Canada and got to hear from incredible volunteers and staff from right across the country. They do remarkable work supporting vulnerable Canadians every day, and that includes this Thanksgiving weekend. No one should be left behind, regardless of where they live. In July, when we finalized the Safe Restart Agreement, the federal government and the First Ministers recognized that smaller jurisdictions face distinct challenges and circumstances. Today, I can announce that additional top-up funds of over $37 million will be included in the first payments to the territories under this agreement. A supplemental $41.4 million will also go towards air carriers to ensure essential air services to remote communities in the north. Minister LeBlanc will have more details in a few minutes, but I want to especially thank MPs Larry Bagnall and Michael McLeod and our Minister of Northern Affairs, Dan Vandal, for their leadership and their important work on supporting our northern communities. Je sais que la longue fin de semaine arrive et que plusieurs sont déçus de ne pas pouvoir se rassembler. L'Action de grâce telle qu'on la connaît sera peut-être différente, mais on s'engage ensemble à faire tous les efforts possibles pour freiner la propagation du virus au cours des prochaines semaines pour que nous puissions peut-être se reprendre à Noël en personne avec ceux qu'on aime. Chaque fois que vous portez un masque, que vous restez à la maison quand ce n'est pas nécessaire de sortir, que vous dites à un ami de télécharger l'application Alerte COVID, vous faites partie de la solution. Our Thanksgiving traditions may be temporarily changed by this pandemic, but our resilience and our determination remain strong. What we do now will shape the numbers we see in 2 weeks and set us, hopefully, on the right track for family gatherings at Christmas. So let's work together and let's flatten the curve. Merci. Je passe maintenant la parole à notre vice-première ministre, Chrystia Freeland. Chrystia.
Okay. Merci, Monsieur le Premier Ministre. Since the beginning of this pandemic, our government has supported Canadian businesses hurt by COVID-19 and its economic fallout. This includes help with payroll costs through the Canada Emergency Wage Subsidy, interest-free loans and grants to small businesses through CEBA, and rent assistance. In last month's speech from the throne, our government committed to further steps to help businesses weather this storm. In keeping with this pledge, today we are announcing additional targeted support for businesses and their workers. I want to stress that this is not for everyone. Some businesses are able to work at full capacity despite COVID-19, and they are doing well. And that's great. This support is not designed for them. These measures are targeted to help those who need it most for the time when they need it. The difficult reality is that the health measures we are taking to contain COVID-19 mean there are some businesses that simply cannot operate at full capacity, and some are closed down by public health orders. These measures are to support those businesses and to provide a bridge for all of us to the full containment of the virus. As the circumstances of businesses improve, support will decrease. If circumstances worsen, it will increase. That is an automatic feature built into these programs. These measures are the result of ongoing consultations by me and my office, by Mary Ng, the Minister of Small Business, Export Promotion and International Trade, and her office with affected businesses. We have also been working very closely with the provinces and territories. And I want to stress that these consultations will continue as we adjust to meet ever-changing circumstances. I also want to particularly thank National Revenue Minister Diane Leboutillier, the Commissioner of the CRA, Bob Hamilton, and everyone at the CRA for so effectively delivering critical support to Canadians. Alors, les programmes. Premièrement, nous allons mettre en place une nouvelle subvention d'urgence du Canada pour le loyer. Cette subvention permettrait aux entreprises et aux autres organisations qui ont subi des pertes de revenus durant cette crise d'avoir accès à une aide pour le loyer jusqu'en juin 2021. Cette nouvelle subvention vient remplacer l'aide d'urgence du Canada pour le loyer commercial qui s'est terminée à la fin de septembre. Elle couvrirait jusqu'à 65% du loyer ou des paiements d'intérêts hypothécaires des entreprises les plus durement touchées, soit celles qui ont enregistré une baisse de revenus de 70% ou plus. Pour les entreprises qui ont subi une baisse de revenus de moins de 70%, la subvention de base diminuerait progressivement en fonction de la base subie, ce qui nous permettra d'apporter une aide plus ciblée et plus accessible. C'est une approche semblable à celle privilégiée dans le cadre de la subvention salariale d'urgence du Canada, qui connaît beaucoup de succès. Afin de simplifier le processus de demande pour les entreprises, la subvention d'urgence du Canada pour le loyer sera versée par l'entremise de l'Agence du revenu du Canada. Je tiens à souligner un élément important. Cette subvention sera directement accessible aux entreprises et aux organisations qui louent leurs locaux. elle sera directement accessible aux locataires. Deuxièmement, comme nous l'avons promis dans le discours du trône, nous allons fournir un soutien ciblé additionnel aux entreprises qui doivent à nouveau fermer leurs portes à cause d'un confinement. Nous savons qu'à travers le pays, alors que nous luttons contre la deuxième vague, les autorités de santé publique imposent de nouvelles restrictions. C'est la bonne chose à faire, mais ça impose des coûts. Ce soutien ciblé aidera les entreprises à traverser un nouveau confinement et nous aidera tous à faire le bon choix. Les entreprises qui font face à un confinement auraient un complément de 25% du loyer admissible en cas de fermeture temporaire et du manque à gagner en raison d'une ordonnance de la santé publique émise à cause de la pandémie. Troisièmement, nous prolongeons la subvention salariale d'urgence du Canada jusqu'en juin 2021, comme nous l'avons annoncé dans le discours du trône. Nous gelons aussi le taux de subvention actuel à 65% jusqu'au 19 décembre. Cette mesure aidera les entreprises à protéger les emplois en gardant le travailleur et en encourageant les employeurs à rembaucher leurs employés mis à pied. Enfin, le gouvernement bonifie la compte d'urgence pour les entreprises canadiennes ou le CUEC, et ce qui permet aux entreprises déjà admissibles à un prêt au titre du CUEC d'obtenir un prêt additionnel de 20 000 $ en fonction de leurs besoins. Jusqu'à la moitié de ce financement supplémentaire, soit 10 000 $ pourrait être changé en subvention si le prêt est remboursé d'ici le 31 décembre 2022. De plus, la date limitée pour la demande de prêt au titre de CUEC est repoussée au 31 décembre 2020. Pour y être admissibles, les entreprises devront attester des pertes de revenus attribuables à la pandémie. Les entreprises devront avoir subi des pertes attribuables à la pandémie. Les détails concernant le moment et la façon d'obtenir ce nouveau financement seront annoncés dans les prochains jours. Je tiens à souligner encore une fois que ceci est un soutien ciblé en fonction des besoins d'entreprise. Elle cible les entreprises qui, pour les raisons indépendantes de leur volonté, ne peuvent pas fonctionner à pleine capacité en raison des mesures de la santé publique qui ont été mises en place pour lutter contre la pandémie. So let me go through the new measures we are announcing today. First, we will introduce a new Canada Emergency Rent Subsidy. This program will provide access to rent support until June 2021 for businesses and other organizations that have lost revenue in this crisis. This new program replaces the Canada Emergency Commercial Rent Assistance Program, which expired at the end of September. The new program will cover up to 65% of rent or mortgage interest payments for the hardest hit businesses with a revenue decline of 70% or more. For businesses that have experienced a decline of revenue of less than 70%, there will be a gradually decreasing level of support in line with the decline in their revenues. This will be a way of delivering more targeted and accessible rent support. The program mirrors the successful Canada Emergency Wage Subsidy and will be delivered by the Canada Revenue Agency to make the application process easier for businesses. I want to stress one element of the plan. This support will be available to businesses and other organizations that rent their premises. This will be available directly to tenants. Second, as promised in the speech from the throne, we will provide additional targeted support to businesses subject to additional lockdown restrictions. We know that across the country, as we fight the second wave of COVID-19, public health officials have been imposing new restrictions. That is the right thing to do, but it imposes costs. This new targeted support will help businesses get through the lockdown and help all of us to do the right thing. The lockdown businesses will get a top-up of 25% of eligible rent in the event of a temporary closing and revenue shortfall due to a mandatory public health order caused by the pandemic. Third, we're extending the Canada Emergency Wage Subsidy until June 2021, as promised in the speech from the throne, and we're freezing the current subsidy rate of 65% of eligible wages until December 19th. This will help businesses keep workers on the payroll and encourage employers to rehire employees who had previously been laid off. And finally, we are expanding the Canada Emergency Business Account, or CEBA, which will enable businesses who have already qualified for a CEBA loan to get an additional loan of $20,000. Of this additional financing, up to half, or $10,000, will be forgivable if repaid by June 31st, 2022. The application deadline for CEBA loans is also being extended to December 31st, 2020. To qualify for this second round of support, businesses will need to attest to losses in revenue due to the pandemic. Details of when and how to access this new funding will be announced in the coming days. Again, I stress that this is targeted support based on need. It is for businesses that, through no fault of their own, cannot operate at full capacity because of public health measures put in place to fight the pandemic. These targeted measures will provide a bridge for our businesses and for all of us to get through to the other side of this pandemic. And they will give businesses and communities and public health officials across the country the economic support they need to fight the pandemic in a smart, targeted way. They will help us all to do the right thing. This is the economically smart thing to do, and it's the right thing to do. Merci. Et je vous souhaite tous une joyeuse action de grâce. Thank you, and I wish everyone a safe and happy Thanksgiving. And now I'll turn it over to Minister Bibeau. Marie-Claude, à vous la parole.
Merci, ministre Freeland. Alors, bonjour à tous. Merci d'être avec nous aujourd'hui. Ces derniers jours, ces derniers mois, les gestionnaires et les bénévoles des banques alimentaires ont redoublé d'efforts pour répondre à la demande exceptionnellement importante des gens dans le besoin et nous voulons leur dire merci. Nous sommes conscients que malgré toutes les aides offertes par notre gouvernement, cette deuxième vague de la COVID-19 prive encore beaucoup de gens de leurs revenus et que nos organisations communautaires doivent continuer à combler les besoins alimentaires de nombreuses familles, d'aînés et de personnes vivant seules partout à travers le pays, incluant dans nos communautés autochtones et nordiques. Je suis donc heureuse aujourd'hui de me joindre au Premier ministre pour annoncer que nous doublons le fonds d'urgence pour la sécurité alimentaire avec une deuxième tranche de 100 millions de dollars. As Minister of Agriculture and Agri-Food, I'm so proud to support our second investment of $100 million in the Emergency Food Security Fund. Up till now, that funding has supported more than 1,800 local food organizations across Canada, including 6 million meals for 2 million Canadians from coast to coast to coast. To give you another example, through the Food Surplus Rescue Program, we have distributed over 1.3 million pounds of turkey to the Food Banks Canada network. Throughout the pandemic, food banks and organizations addressing food insecurity have worked tirelessly to help Canadians in need. I would like to thank everyone who has donated to their local food bank, food organizations, and encourage all of those who can to consider giving. For our government, letting local food organizations face the pandemic alone was out of questions. And this is why, in addition to the $200 million, we have invested $50 million to redirect surpluses from the agri-food sector and $25 million in Nutrition North to help promote communities access food. En terminant, je souhaite remercier tous les travailleurs du secteur alimentaire. Je cède maintenant la parole au ministre des Affaires intergouvernementales et président du Conseil privé, Dominique Leblanc.
Merci, Marie-Claude. Monsieur le Premier Ministre, this summer, we announced the government would be investing $19 billion through the Safe Restart Agreement to help territories and provinces respond to COVID-19. Provinces and territories are now using these funds to meet their local priorities, such as improving testing capacity and offering wage top-ups to essential workers. We also recognize that remote, isolated, and northern communities have unique needs, which require additional funding and support. Today, as the Prime Minister noted, we are announcing territories will receive an additional federal investment of $37.2 million to the Safe Restart Agreements. Our government also understands just how critical northern air services are, from ensuring food supply chains remain intact to providing medical care and transportation needs to some of Canada's most remote communities. This is why we are investing an additional $41.4 million to maintain these airline services. With today's announcement, to be precise, Yukon will be receiving $19.6 million in additional support from the Government of Canada. The Northwest Territories will be receiving $29.3 million, and Nunavut will be receiving $29.6 million. I want to thank Premiers Silver, Cochrane, and Savikatak for their hard work in keeping their communities safe and their continued leadership throughout this pandemic. And as the Prime Minister noted, members of Parliament Michael McLeod and Larry Bagnall have also been fierce defenders of the unique needs of their territories. Nous allons continuer de travailler en partenariat avec les provinces et les territoires afin d'appuyer les Canadiens pendant ces temps si difficiles. With that, the Deputy Prime Minister said, Happy Thanksgiving, and I'm now happy to turn it over to our colleague, the Minister of Health, Patty Hajdu.
Well, thank you very much, colleagues. Pleasure to join you and the Prime Minister today. Listen, living through a global pandemic has not been easy on anybody, and our lives have all been disrupted and upset. We've all had to change and adapt so much. Families have been strained. People have lost jobs. We've had to let go of celebrations, change our plans, and forego seeing our loved ones. And then on top of that, many of us have been separated from our friends and our natural support networks, just as we need them the most. And of course, far too many lives have been lost to COVID-19 here in Canada and indeed around the world. And now, as winter approaches and Thanksgiving is this weekend, we're missing our routines that much more and our loved ones. But we do need to reduce our contacts, because when we reduce our social contacts and stay close to home, keep our gatherings limited to our households, this is indeed an act of love, even if it doesn't feel like it. COVID-19 is a very sneaky virus, but if we all keep our Thanksgiving small this weekend, we can keep it out of our homes and keep people out of intensive care over the next several weeks. Each of us has it in our power to reduce the spread of COVID-19. Demain est la journée mondiale de la santé mentale. On ne peut pas ignorer le fait que les circonstances extraordinaires que nous vivons nous affectent. Cette pandémie a peut-être été la première fois que vous avez eu à vivre avec de l'anxiété, de la peur ou une moins bonne santé mentale. La pandémie a aussi été un obstacle pour accéder aux services de santé mentale. C'est pourquoi nous avons mis sur pied des ressources en ligne. Et la pandémie peut avoir conduit certaines personnes à augmenter leur consommation. All along, we focused on supporting people to get mental health resources to manage through this pandemic. I will remind everyone to visit wellnesstogether.ca to see what is available. But different things work for different people. So to better understand what can help protect the mental health of Canadians, today I'm announcing that our government, with our provincial partners, are investing over $10 million. This funding will support COVID-19 related mental health and substance use research projects across our country. The project will be led by the Canadian Institutes of Health Research, and it will support 55 research teams to understand how the pandemic is affecting different groups of people and what can help them to protect their health and feel better. A couple of examples include Dr. Matthew Sloan at the Centre for Mental Health and Addiction, who will test a remote treatment service to help people experiencing alcohol withdrawal. Dr. Deborah DaCosta at the McGill University Health Center will evaluate the need for an online program that can address the mental health needs of pregnant women and new mothers. And Dr. Penny Corkum at Dalhousie University will study the benefits of a virtual intervention to promote good sleep and mental wellness for children and families. This funding was made possible thanks to the collaboration with our provincial partners, and I want to thank them for continuing to work with us on this important initiative. On behalf of our government, I would like to thank the researchers and their teams who are doing this incredible, critical work very quickly to help improve the lives of Canadians. Thank you.
Bonjour tout le monde. So before we provide an update on the national epidemiology and modeling work that informs our ongoing management of COVID-19 in Canada, I'll begin with some of the latest overall numbers. There have been 175,559 cases of COVID-19 reported to date, including 9,557 deaths. Labs across Canada continue to test at a high rate, with an average of over 71,000 people tested daily last week, and 2.5% of these testing positive.
Bonjour. Aujourd'hui, nous ferons le point sur l'épidémiologie nationale et les travaux de modélisation qui guident la prise en charge continue de la COVID-19 au Canada. Mais d'abord, je vais commencer par les derniers chiffres généraux. À ce jour, 175 559 cas de COVID-19 ont été signalés au Canada, dont 9 557 décès. Les laboratoires partout au Canada continuent de tester à un taux élevé, avec une moyenne de plus de 71 000 personnes testées quotidiennement la semaine dernière et 2,5% de ces tests positifs. Dans la présentation suivante, nous discuterons du portrait épidémiologique national de COVID-19 au Canada et examinerons de plus près les présentations régionales de la pandémie.
Slide 2. The national case count has doubled since our last epidemiology and modeling update on September the 22nd. Yesterday, with over 2,400 new cases reported, we had the highest one-day increase in reported cases since the start of the pandemic. The acceleration of epidemic growth is concerning. The actions of individual Canadians are needed now to reverse this trend.
Diapositive 2. Le nombre quotidien de cas à l'échelle nationale a doublé depuis notre dernière mise à jour d'épidémiologie et de la modélisation le 22 septembre. Hier, avec plus de 2400 nouveaux cas signalés, nous avons enregistré la plus forte augmentation journalière d'un jour de cas signalés depuis le début de la pandémie. Cette accélération de la croissance épidémique est préoccupante. Les actions individuelles des Canadiens sont nécessaires maintenant pour inverser cette tendance.
Slide 3. As we've said before, these national trends are a composite of the regional epidemics that vary widely across the country. The incidence of COVID-19 is increasing in several provinces, with the most rapid increases occurring in Quebec, Ontario, and Alberta. In contrast, there has been no significant resurgence of cases in the Atlantic bubble, and there has been no community transmission of COVID-19 in the territories.
Diapositive 3. Comme nous l'avons déjà dit, ces tendances nationales sont un composé des épidémies régionales qui varient considérablement à travers le pays. L'incidence de la COVID-19 augmente dans plusieurs provinces. Les augmentations les plus rapides se produisent au Québec, en Ontario et en Alberta. En revanche, il n'y a pas eu de résurgence significative de cas dans la bulle atlantique. Il n'y a pas eu de transmission communautaire de la COVID-19 dans les territoires.
Slide 4. So the time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Canada's RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada is passing the virus to more than 100 others, and so on, with each new generation of spread getting a bit larger. So we need to limit our contacts and opportunities for the virus to spread to bring the RT below 1 again.
Diapositive 4. Le taux de reproduction effectif variable dans le temps, ou RT, représente le nombre de personnes infectées par chaque nouveau cas. Lorsque chaque nouveau cas infecte moins d'une personne, l'épidémie s'éteindra. Le RT au Canada est supérieur à 1 depuis la fin août, ce qui signifie
Reporting incidence rates of over 50 cases per 100,000 over the past 14 days, including additional northern and rural areas. The number of active cases is also rising in First Nations communities, with a majority of cases in Alberta, Saskatchewan, and Manitoba.
Diapositive 5. Cette carte montre les régions socio-sanitaires ayant les taux d'incidence de COVID-19 les plus élevés au cours des 2 dernières semaines dans des tons de bleu plus foncés. Par rapport à notre dernière mise à jour du 22 septembre, davantage de régions socio-sanitaires rapportent des taux d'incidence de plus de 50 cas par 100 000 au cours des 14 derniers jours, y compris d'autres régions plus au nord et rurales. Le nombre de cas actifs augmente également dans les communautés des Premières Nations du pays, avec la majorité des cas en Alberta, Saskatchewan et au Manitoba.
Slide 6. Since the beginning of September, the incidence of COVID-19 has been increasing across all age groups. While we have consistently observed the highest incidence of COVID-19 among young adults aged 20 to 39 years, we're now seeing a concerning rise in the incidence among individuals 80 years of age and older, who are at the highest risk of severe and fatal outcomes.
Diapositive 6. Depuis le début du mois de septembre, l'incidence de la COVID-19 augmente dans tous les groupes d'âge. Bien que nous ayons constamment observé l'incidence la plus élevée de COVID-19 chez les jeunes adultes âgés de 20 à 39 ans, nous constatons maintenant une augmentation préoccupante de l'incidence chez les personnes de 80 ans et plus qui sont les plus à risque de conséquences graves et de décès.
Slide 7. Along with the climbing daily case counts over the past several weeks, an increasing number of outbreaks have been reported in a variety of settings. Although there have been over 250 schools across the country reporting 2 or more cases, only 50 of these clusters involve 5 or more cases, with little indication of transmission happening within the school environment to date. Of concern are the growing number of outbreaks in long-term care facilities. While these involve smaller case numbers than in April and May, we must do everything possible to limit the size and impact of outbreaks in these high-risk settings. At the same time, a larger number of outbreaks are being reported related to private indoor gatherings, which several jurisdictions have noted are contributing significantly to the spread of COVID-19.
Diapositive 7. En plus de l'augmentation du nombre de cas quotidiens au cours des dernières semaines, un nombre croissant d'éclosions a été signalé dans divers contextes. Bien que plus de 250 écoles à travers le pays aient rapporté 2 cas ou plus de COVID-19, seulement 50 impliquent 5 cas ou plus, avec peu d'indications de transmission se produisant dans l'environnement scolaire à date. Le nombre croissant d'éclosions dans les établissements de soins de longue durée est plus préoccupant. Bien que le nombre de cas soit moins élevé qu'en avril et mai, nous devons faire tout notre possible pour limiter l'ampleur et l'impact des éclosions dans ces milieux à haut risque. Aussi, un nombre plus important d'éclosions sont signalées en lien avec des rassemblements privés à l'intérieur et plusieurs régions ont noté qu'ils contribuaient de manière significative à la propagation de la COVID-19.
Slide 8. Currently, the number of COVID-19 cases in hospital daily remains much lower than the peak of 3,000 cases observed during the initial wave, due in part to the younger age of cases in recent months. However, hospitalizations are considered late indicators of disease severity because they lag 1 or more weeks behind the increase in cases. We're now observing an increase in hospitalizations in some regions, and the overall number of COVID-19 cases in hospital per day has more than doubled from 380 cases at the time of our last update to 820 cases in hospital yesterday.
Diapositive 8. Actuellement, le nombre de cas de COVID-19 hospitalisés quotidiennement reste bien inférieur au pic de 3 000 cas observés lors de la première vague, ce qui s'explique probablement en partie par le jeune âge des cas au cours des derniers mois. Cependant, les hospitalisations sont considérées comme des indicateurs tardifs de la gravité de la maladie car elles sont déclarées d'une ou plusieurs semaines par rapport à l'augmentation des cas. Nous observons maintenant une augmentation des hospitalisations dans certaines régions et le nombre total des cas de COVID-19 hospitalisés a plus que doublé, passant de 380 cas au moment de notre dernière mise à jour épidémiologique à 820 cas hospitalisés hier.
Slide 9. As with hospitalizations, deaths are also late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks, owing to the prolonged natural history of the disease. After more than 2 months observing fewer than 8 deaths reported daily on average, over the past week, the average number of deaths reported daily has increased to 18.
Diapositive 9. Comme pour les hospitalisations, les décès sont également des indicateurs tardifs de la gravité de la COVID-19 et peuvent être décalés de plusieurs semaines par rapport à l'augmentation des cas déclarés en raison de l'évolution naturelle prolongée de la maladie. Après avoir observé pendant plus de 2 mois moins de 8 décès par jour en moyenne, le nombre moyen de décès signalés quotidiennement est passé à 18 au cours de la dernière semaine.
Slide 10. Based on Canadian data up to October the 2nd, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to October the 17th. The graph on the left shows the predicted number of cases could be in the range of 188,150 to 197,830 by October the 17th. The graph on the right shows the predicted number of deaths could be in the range of 9,690 to 9,800 by October the 17th. Note that the line tracking cumulative deaths increases in a single step by 114. This does not reflect a single-day increase, but rather the reconciliation of data from Ontario for deaths that occurred in the spring or summer. The forecast has been adjusted to account for this new information.
Diapositive 10. Selon les données canadiennes jusqu'au 2 octobre, les prévisions à court terme indiquent les cas et les décès prévus dus à la COVID-19 jusqu'au 17 octobre. Le graphique de gauche montre le nombre prévu de cas qui pourrait se situer entre 188 150 et 197 830 d'ici le 17 octobre. Le graphique de droite montre que le nombre prévu de décès pourrait se situer entre 9 690 et 9 800 d'ici le 17 octobre. Notez que la ligne de suivi de décès cumulatifs augmente de 114 en une seule étape. Cela ne reflète pas une augmentation sur une seule journée, mais plutôt le rapprochement des données de l'Ontario pour les décès survenus au printemps ou en été. La prévision a été ajustée pour tenir compte de ces nouvelles informations.
Slide 11. This graph shows the results of dynamic modeling studies that look at how the epidemic may evolve in Canada over the next month. Based on the current increasing daily case counts, the graph shows that if we maintain, that's the gray line, or increase, that's the orange line, our current rate of contacts with other people, the epidemic is forecast to continue increasing steeply. More importantly, in order to bend the epidemic curve and reduce transmission to lower levels as shown by the blue line, we must decrease our current rate of contacts by 25 to 35%. We can reduce our rate of contact with other people through a combination of individual practices and population-based measures. However, in some areas, individual actions have not been enough to realize low levels of transmission, and additional measures, including strategic business closures, have been required in order to put the brakes on the epidemic growth.
Diapositive 11. Ce graphique montre les résultats d'études de modélisation visant à explorer comment l'épidémie pourrait évoluer au cours du prochain mois. Le graphique, qui tient compte de l'augmentation actuelle du nombre de cas quotidiens, montre que si nous maintenons ou augmentons notre taux actuel de contact avec d'autres personnes, l'épidémie devrait continuer de progresser rapidement. La ligne grise, maintien, et ligne orange, augmentation. Aspect plus important, pour infléchir la courbe épidémique et réduire les niveaux de transmission, comme le montre la ligne bleue, nous devons diminuer de 25 à 35 % notre taux actuel de contact. Nous pouvons réduire notre taux de contact grâce à une combinaison de pratiques individuelles et des mesures axées sur la population, dont les fermetures stratégiques d'espaces économiques et sociaux. Cependant, dans certains secteurs, les mesures individuelles n'ont pas été suffisantes pour atteindre le faible niveau de transmission, et d'autres mesures, dont la fermeture stratégique d'entreprises, se sont avérées nécessaires pour freiner la progression de l'épidémie.
Slide 12. If strategic closures are needed to reduce contacts between individuals, results of dynamic modeling shows us that acting fast will have the greatest impact. The top right and the bottom left images on this slide shows the contrasting results of a slow versus a fast implementation on the number of cases. Decisions on where and when to target measures will continue to be locally driven based on consideration of the incidence of COVID-19 and strain on the public health and health system. We are at an important juncture in the pandemic where we would very much like to see the voluntary actions of Canadians across the country be sufficient to bend the curve downward. This will require sustained and intentional efforts to limit contacts and reduce opportunities for transmission. This will not be easy and will require hard choices between what we need to do and what we would like to do.
Diapositive 12. Selon les résultats de la modélisation dynamique, une intervention rapide aura le plus d'impact si des fermetures stratégiques sont nécessaires pour réduire les contacts. Les images en haut, à droite et en bas, à gauche de la diapositive, montrent la différence sur le nombre de cas entre une mise en œuvre lente et une mise en œuvre rapide. Les décisions visant à savoir où et quand mettre en œuvre ces mesures ciblées continueront de dépendre du contexte local en tenant compte du nombre et de la gravité des cas de COVID-19 ainsi que des pressions qu'ils exercent sur les systèmes de santé publique et les systèmes de santé. Nous sommes à la croisée des chemins en ce qui concerne la pandémie. Nous aimerions beaucoup que les actions volontaires des Canadiens partout au pays suffisent à faire baisser la courbe. Pour y arriver, il faudrait des efforts soutenus et délibérés pour limiter le nombre de contacts et réduire les occasions de transmission. Ce ne sera pas chose facile. Il nous faudra faire des choix difficiles entre ce que nous devons faire et ce que nous aimerions faire.
Slide 13. Given the epidemic is unfolding differently across the country, it is important to stay up to date on the situation in your area. There are a number of tools available to help you stay informed and assess your regional and personal risk.
Diapositive 13. Comme l'épidémie évolue différemment d'une région à l'autre du pays, il est important de vous tenir au courant de la situation dans votre région. Il existe plusieurs outils vous permettant de rester informé et d'évaluer votre risque régional et personnel.
So, slide 14. We are all faced with unique circumstances this Thanksgiving weekend and into the fall and winter. This is often a time for family gatherings and celebrations inside cozy homes. But our celebrations need to look different this year. Keep it small, keep it safe, and protect your families, friends, and yourselves. The epidemic's trajectory is not inevitable. There is much we can do now to limit the impact of COVID-19 on the lives and livelihoods of Canadians. Let's act together so our actions can reduce the spread of the virus. Let's start today. Thank you.
Diapositive 14. Nous serons tous confrontés à des situations particulières pendant la fin de semaine de l'Action de grâce ainsi que cet automne et cet hiver. C'est souvent l'occasion de rassemblements et de réjouissances en famille à l'intérieur des foyers. Nos fêtes devront se dérouler de façon très différente cette année. Ne faites pas de grands rassemblements, restez en sécurité pour vous protéger et protéger votre famille et vos amis. Il est possible de changer la trajectoire de l'épidémie. Il y a bien des choses que nous pouvons faire maintenant pour limiter les répercussions de la COVID-19 sur la vie et les moyens de subsistance des Canadiens. Unissons nos efforts pour réduire la propagation du virus. Commençons dès aujourd'hui. Merci.
Thank you, doctors. We'll now turn to the phone for questions. Just as a reminder, as there's a number of different things to talk about today, the Prime Minister will be available for about 20 minutes of questions, and then the ministers and doctors will be available afterwards. We'll start on the phone. One question, one follow-up. Operator.
Thank you, merci. First question, Kate Balangaro, Bloomberg, line open.
Good afternoon, Prime Minister. I have a quick question for you regarding what's happening in the U.S. With a right-wing militia plot to kidnap Michigan's Democratic governor foiled, which is a direct state that is directly our neighbor, and increasing polarization across the U.S., should Canadians be worried about the possibility of U.S. election violence?
In Canada, we have been very alert to incidences of extremist violence, particularly right-wing violence, for some time now. We're going to keep an eye on this situation and continue to keep Canadians safe. Of course, we're watching events fold in the United States in this election season. And while I won't comment on the election situation, I will continue to emphasize that my job and our job as a government is to continue to stand up for Canadian interests and keep Canadians safe. That's exactly what we'll keep doing.
Follow-up, Kate?
Well, and exactly. Since your role is here in Canada, I'm wondering, have Canadian defense, intelligence, and law enforcement agencies been instructed to take any actions or precautions as a result of this violence?
Our security and intelligence agencies continue to monitor things that happen inside our borders and around the world and make decisions designed to keep Canadians safe. We will continue to work closely with our security agencies to ensure that we are doing everything necessary to keep Canadians and our communities safe. Évidemment, nos agences de sécurité et de renseignement travaillent très fort pour garder les Canadiens en sécurité, particulièrement dans les menaces de violence d'extrême droite. Nous allons continuer de surveiller la situation partout dans le monde et nous allons nous assurer de faire tout ce qui est nécessaire pour garder les Canadiens en sécurité. C'est notre priorité numéro 1.
Merci. Prochaine question. Operator.
Thank you, merci. Next question, Jamie Pashagomskum, APTN. Please go ahead.
Hi, Mr. Prime Minister. This question is for you. Please interrupt me if you can't hear me. I have bad connection sometimes. It's been 21 years since the Marshall decision, and still Mi'kmaq fishermen are being denied their right to fish. Now, there's a new round of negotiations between the Mi'kmaq and the DFO. My question is, why should the Mi'kmaq have any trust in this process when it's been 21 years and they're still being denied the treaty right to fish? So what do you think they need to get resolution?
There's no question that 21 years is far too long to wait to see rights that have been recognized come into force. That is why, as a government, we have worked so hard on so many different approaches on reconciliation to make up for time lost by previous governments. This is a situation that is extremely important to resolve peacefully. That's why the Minister of Fisheries and others are engaged in discussions and negotiations on a way forward that will be fair for everyone. But we recognize the rights enshrined in the Marshall Decision, the rights of Indigenous peoples, and we will continue to work hard to defend them.
Follow-up question, Jamie?
Yes, thank you. Now, in a couple of hours, there's going to be a demonstration taking place in front of the Supreme Court building here in Ottawa. They're calling it Indigenous Rage Against Colonialism. It's sort of encompassing all issues, you know, the Mi'kmaq, the Wet'suwet'en, land occupiers in Caledonia, tiny house, and it shows the moose moratorium. Now, if you were down there, what would you tell these people today?
That I share their impatience. The world needs to, and Canada needs to move further down the path of reconciliation. We have done much over the past years in terms of closing funding gaps for education, in terms of investing in mental health supports, investing in economic pathways, and resolving treaty differences in terms of eliminating long-term boil water advisories. But there is much more to do, and we will continue to work hand in hand with Indigenous peoples. Not just Indigenous peoples want to see this happen, but non-Indigenous peoples as well want Canada to turn its page on its colonial past, and that's what we're all working very hard on together.
Thank you, and we'll take one more question on the phone for now. Operator?
Thank you, merci. Prochaine question, Marie-Vastel Le Devoir, à vous.
Oui, bonjour. En fait, ma question est pour Madame Freeland. Désolée, mais j'étais dans la line-up des questions, donc je vais la poser. Madame Freeland, j'aimerais obtenir des petites précisions sur vos annonces pour l'aide aux entreprises, s'il vous plaît. D'abord, sur la subvention salariale, vous dites que ça va être gelé autour de 65 %. Donc, j'en comprends qu'on n'atteint plus le 75 % du départ. Et vous dites que ce sera ça jusqu'à décembre. Donc, est-ce que par après, le taux va diminuer de façon progressive par mois, comme c'était prévu en vertu du programme tel qu'annoncé cet été?
C'est exactement ça. On va geler le programme au niveau qu'on a maintenant.
Puis après, ça descend.
Et on va et je vais préciser encore une fois, on va geler le programme de subvention salariale au niveau qu'on a maintenant jusqu'au 19 décembre, que sera la fin du période 10.
OK, donc j'en comprends qu'après, ça va descendre par mois. Mon autre question, c'est sur le loyer commercial. Plusieurs se plaignaient que les entreprises n'avaient pas accès parce qu'il fallait passer par un propriétaire. Là, vous dites que ce sera directement aux locataires qui ont suffisamment de baisse de revenus. Combien d'entreprises est-ce que votre ministère pense pouvoir aider avec la nouvelle subvention pour le loyer? Et j'aimerais savoir combien est-ce que toutes ces nouvelles aides-là vont coûter selon vos projections?
Merci pour la question. C'est difficile jusqu'à maintenant de préciser combien de gens seront aidés par les nouveaux programmes de loyer commercial, surtout parce qu'on a on a beaucoup d'éléments qui dépendent du coronavirus. On a cette aide spécifique qu'on donnera encore 25 % pour les entreprises qui sont sujets d'une décision pour la santé publique. Et aussi, comme vous comprenez très bien, l'aide dépendra du niveau des revenus. Mais nos projections, et je veux vraiment souligner que c'est seulement projection parce que tout dépend de ce qui se passe avec le coronavirus. Et comme Dr. Tam et Dr. nous avons expliqué, il y a beaucoup d'imprévisibilité concernant le coronavirus et nous tous devons réagir correctement pour aplatir le courbe. Notre projection concernant le loyer, c'est que jusqu'au fin de cette année, ça coûtera 2,2 milliards de dollars. C'est pour le loyer. Et je peux répondre concernant les autres programmes si vous voulez. Sure. In terms of projections of the cost of the new rent support program, it is impossible to be precise because the take-up of this program will depend directly on what happens with the coronavirus. And so it will actually depend directly on how well Canadians do in flattening the curve. Having said that, of course, we have made some projections, and our current projection is the new rent support will pay out around $2.2 billion between now and the end of the year. And that is both the overall rent support and the additional targeted 25% top-up, which will go to businesses that are subject to a specific additional public health restriction.
Thank you. We'll now go to the room. Mike?
Prime Minister Mike Lecouteur from Global National. The slides that we just saw showed how Canada very clearly crushed the curve in the spring by completely shutting down. Dr. Tam even just said that the epidemic growth is concerning at this point in time. So why does your government continue to favor a more surgical approach rather than another shutdown, which clearly worked?
We know that the epidemic path across the country is very variable. All businesses, all families across the country have been affected by coronavirus, but we are seeing spikes in this second wave in certain areas. We know a lot more about where transmissions are happening, what businesses and what activities create particular vulnerabilities, and that's why in the second wave we're able to be more targeted in our approach. But let's make no mistakes about it. This second wave is really frustrating for a whole bunch of people who've been through this spring and who don't want to see this happen right now. A whole bunch of us would love to see this simply go away. Well, it'll only go away if we all do our part. Different orders of governments have stepped up in a lot of different ways in terms of testing, in terms of programs, in terms of supports, in terms of health measures to get us to this point. But Canadians have also done their part. Everyone did their part in the spring to flatten that curve and to get us through a decent summer. But now we're in this second wave. And the behaviors people take on this weekend will be things that we look back at 2 weeks ago to see whether we started to shift the direction of this second wave or not. The epidemic potential, the epidemic curve is clear. The actions we take now will determine that. That's why this coming weekend, for Thanksgiving and for the weeks to come, we need people to do everything they can to prevent transmission of this virus. Stay home as much as possible. Listen to the public health advice. Download the COVID Alert app. Wear a mask and really, really pull together and lean in by stepping apart these coming weeks so that we change the direction of this curve. We get things back under control so we don't have to continue to escalate the measures we have. Public health measures and government measures can do part of it, but only citizens can actually determine how this outcomes look over the coming months. That's what we have to step up on now.
Sur les mesures.
Depuis plusieurs mois, nous apprenons ce qui fonctionne pour la COVID-19. Et au printemps, on a vu qu'on a pu, avec un confinement national, arrêter cette épidémie ou ralentir massivement cette épidémie. Malheureusement, on se retrouve dans une deuxième vague maintenant et on peut mettre de l'avant des outils et des approches que nous savons vont être utiles en ciblant nos fermetures, en sachant quel genre d'activités ou d'entreprises sont plus enclins à transmettre ou à créer des foyers de transmission ou des éclosions de la COVID-19, nous pouvons être mieux ciblés dans notre approche. Mais on ne va pas se tromper, c'est extrêmement déplaisant pour nous tous de devoir faire face à une deuxième vague et je sais que beaucoup de gens veulent tout simplement que ça disparaisse. Eh bien, ça va seulement le faire si tout le monde fait sa part. Dans 2 semaines, on va regarder ce qui s'est passé pendant cette fin de semaine de l'Action de grâce et on va pouvoir se dire si oui ou non on a fait les bonnes choses. C'est pour ça que les gens doivent faire attention de limiter leurs contacts pour empêcher plus d'éclosion de la COVID-19. Et on fait ça en gardant nos distances, en restant à la maison le plus possible, en téléchargeant l'application COVID Alert, en faisant les choses que nous savons vont porter fruit dans les semaines à venir. C'est plate qu'il faut le faire encore, mais on doit faire notre part pour passer à travers ensemble.
Glenn McGregor, CTV News. Prime Minister, one of Dr. Tam's slides was titled, "A Stronger Response is Needed." And my question is, where is it? What is the response from your government other than telling people to download an app and not gather for Thanksgiving? At what point do you say the things that premiers have been doing aren't working, especially here in Ontario? When do you step in? Will you consider using emergency public health measures, the powers you have, to actually manage the response to the epidemic and not just use moral suasion to convince people not to gather?
As we've seen across the country, there are places where the epidemic curve has functioned differently than others, where measures that have been put forward have been successful. The Atlantic bubble is an obvious example, but even across the other provinces, we've seen tremendous variances in effectiveness of various measures and in population behaviors. So we will continue to be there to support the premiers, to support governments in the decisions they make in the interests of their local situation. Our responsibility, as we've laid out, is to continue to support Canadians directly. The CERB through the spring, the wage subsidy through the spring, were things that allowed people to do what was necessary to prevent the spread of COVID-19. And as we laid out in the throne speech, we don't want local public health officers to have to make impossible decisions about what they have to do to close down without knowing that there is going to be support for businesses, for Canadians facing a local or regionalized shutdown. That's why the measures we are announcing today are targeted specifically so that people can make the local public health decisions and recommendations necessary to control this epidemic and know that businesses and families will be supported through these decisions. That's the role of the federal government in this, to support people, to support provinces in the decision-making they're making, to ensure the availability of technologies and supports, to move forward on things like the COVID Alert app, which can and will and is already making a difference in impact around COVID-19. These are the things we will continue to do because these are the things that keep us safe. Of course. Christian.
So, Prime Minister, if I may just underline one really important point the Prime Minister has made. Something that we have all heard as MPs and as ministers, I'm sure you have heard as reporters, is local businesses really, really concerned about new, more restrictive public health measures being imposed. And we are certainly hearing from the provinces and territories, from municipalities, from public health officials across the country, that many of them feel themselves to be in a really agonizing position of frankly knowing what is the right thing to do, but being reluctant to hurt businesses that are already very hard pressed. And that's why, from my perspective, one of the most important things we've announced today is a really novel program, which is this 25% top-up for businesses subject to lockdown restrictions. And what we are aiming to do with this program is to provide the support to public health authorities, to local officials, to do the right thing without fearing that by doing so, they will be hollowing out these businesses that are so important in their communities. So that's a really concrete action that we are taking. And I think we all really hope that with these measures in place, with this safety net in place, public health officials and, local authorities will be really empowered to do the right thing.
Bonjour, Christian Noël de Radio-Canada. C'est une question pour M. Trudeau et Mme Freeland, s'il vous plaît. Au printemps, on avait l'impression que l'argent sortait et qu'on n'avait pas le temps de compter. Là, à l'automne, on entend beaucoup de mesures ciblées, répondre aux besoins. On parle de remboursement. Pourtant, la deuxième vague a l'air d'être plus grave que la première. Alors, pourquoi limiter les dépenses alors que les besoins semblent plus grands?
On est en train de limiter les dépenses pour mieux cibler cette réalité de la deuxième vague. On a pu et on espère pouvoir éviter d'avoir un reconfinement national. On est en train de voir qu'est-ce qu'on peut faire pour limiter les éclosions dans certaines étendues géographiques. Et ce qu'on est en train de cibler, ce n'est pas en train de réduire l'argent qui va aller à ces entreprises, comme la ministre a dit, cette aide directe aux entreprises qui subissent des ordres de confinement ou de fermeture est à 90 %. C'est une aide extrêmement généreuse, mais ce qu'on espère et ce qu'on a vu un peu à travers le monde dans cette deuxième vague, c'est que de bien cibler les mesures, c'est mieux que juste de faire un reconfinement général. C'est moins douloureux pour l'économie, c'est moins pénible pour les citoyens de prendre ce qu'on a appris de la première vague, ce que le monde a appris pour mieux appliquer une façon de vivre avec la COVID et de réduire les éclosions en même temps. C'est exactement ce que ça prenait. Les provinces sont en train de faire leur job en regardant ce qu'il faut faire à chaque étape. Nous, notre job, c'est de s'assurer qu'on est là pour appuyer les Canadiens, les petites entreprises, les communautés affectées par ces décisions médicales et de santé publique nécessaires.
Hi, Prime Minister. Oh, sorry. Go ahead.
Le Premier ministre a répondu parfaitement. Je n'ai rien à ajouter.
Sorry about that. Hi, Prime Minister. Tom Perry from CBC. My question is actually for you and for the Deputy Prime Minister. On the rent relief program you're announcing today, you're going to be giving support directly to businesses now, whereas before the money was going to landlords. In making this change, are you acknowledging that first plan was flawed? And if this was a miscalculation, are you worried that you may have inadvertently caused some businesses to go under?
I think during the first wave of this pandemic, we understood how important it was to try and support people in as many different ways as possible. Now, the secret program actually helped hundreds of thousands of businesses that were able to benefit from that reduction in rent. And we did it in a way that made sense for us to work with landlords, with the tenants, and with the provinces as well that have jurisdiction over the commercial rent program. But as we've seen, this second wave requires more targeted help that flows differently. And we heard clearly from tenants who were frustrated or had landlords who weren't able to participate in the original program. So we made modifications and are coming forward with a support program directly for tenants in commercial businesses. Christian?
Yeah, and the only thing, I would just add a few things to that. One of the reasons that we're providing the rent support in the way that we have outlined today is to simplify everything that is available to businesses. So it's going to be delivered through the same platform and along the same lines as the wage subsidy. Life is very complicated for Canadians right now and unpredictable. COVID is complicated and hard enough for businesses to deal with. We want to make government support as straightforward and as simple as possible. So, operating in tandem with the wage subsidy was a real, desire of ours. So that would be one thing. The second thing, which I think is an advantage of how we propose to deliver this program, is, as the Prime Minister said, it's flexible. So it's not one size fits all. There is a range of support you get with your rent based on what your fall in revenue is. And the reality, that we saw from the doctor's presentation is we don't know what the progress of the coronavirus is going to be. We're seeing that it goes up and it goes down. And we have sought to build a rent support program that can respond to those needs of a business. And then the final thing which we wanted to do with this program was create something which could also be used to deliver this targeted, lockdown triggered additional support. And the way we have put together the rent support program allows us to do that too, without having a whole new program.
It's Man Hamidi from the Canadian Press. I want to ask you about the by-elections in Ontario. If Ontario is ruling back public gatherings and we're seeing obviously the cases are going up on record numbers, would you consider delaying or suspending the elections and maybe rescheduling them for a later date?
One of the things that has been important, I think, for Canadians through this massive disruption that is the pandemic is our democracy and our democratic institutions have continued to function. We've seen that with Parliament continuing to work together in a hybrid model and deliver programs for Canadians with all parties working together. We've seen that with a number of provincial elections gone ahead and underway right now. It is reassuring to Canadians to see that their democracies continue to function even in this difficult situation. The way we work is different, and certainly the way people are campaigning is taking into account the reality of COVID-19. But our institutions are strong and can continue to function. I'd also highlight that it is mandated by law that we hold these by-elections before February of this year. And knowing that, we looked at the calendar and looked at the potential arrival of flu season, of winter time, of the uncertainty around a second wave. We made a determination that moving forward quickly on these by-elections was probably the safest thing to do. There are a few weeks left in that by-election, but there has been campaigning in a safe way up until now. And we see that holding a by-election later in the winter, in January or February, is extremely uncertain in terms of what the situation might be. So I think for the good of everyone who is already underway in this and behaving safely, we've seen candidates and campaigns take into account the reality that we're going through. And I think Canadians can have confidence that our democracy remains strong even in the middle of this pandemic. Je pense que c'est important de souligner à quel point les Canadiens ont été réconfortés de voir que notre démocratie, que nos institutions démocratiques continuent de fonctionner même dans une période extrêmement difficile d'une pandémie globale. On a vu ça avec le Parlement qui continue de se rassembler de façon virtuelle pour passer des projets de loi pour aider les Canadiens, avec des élections provinciales qui ont eu lieu et qui sont en train d'être tenues à travers le pays de façon sécuritaire. Évidemment, les gens doivent faire attention, on modifie notre approche en termes de campagne, mais c'est rassurant pour les Canadiens. Je veux aussi ajouter que, étant donné que, selon la loi, nous devions avoir ces partiels à Toronto avant le mois de février, on faisait face à la période de la grippe, l'hiver qui arrive, une incertitude par rapport à si la deuxième vague pourrait s'empirer de plus en plus. Et on a pris la décision de tenir ces partiels rapidement pour essayer de les résoudre, de les avoir avant que la neige arrive et peut-être plus de complications. Mais on s'attend évidemment à ce que les gens s'adaptent à la situation locale, qu'on cherche des façons virtuelles à communiquer avec les gens et que les candidats et les citoyens soient assurés de leur sécurité pendant cet exercice démocratique.
Prime Minister, Tonda McCharles at the Toronto Star. Canadians have voted in winter months before, but I'm curious, given that Ontario today, their own modeling says that the province could experience worst-case scenarios seen in northern Italy and New York City, where hospitals were overwhelmed. Your decision not to postpone that by-election, today we have one of the candidates actually campaigning there, calling for it to be postponed. If the Elections Canada officer has the ability to at least recommend it, are you saying that your cabinet won't be open to postponing that election?
We will always listen to and work with Elections Canada and their recommendations. At the same time, the very modeling you're pointing out, Tonda, is highlighting that it's likely to get, it's at least possible that things get worse over the coming months. And because by law, we have to fill that by-election, have that by-election before February, a few months from now, it is very likely that postponing the by-election until the last possible moment would actually mean that it would be held in more difficult circumstances. We've already had a number of weeks of campaigning in this by-election in reasonably decent circumstances. Who knows what the next months could bring? We certainly hope things get better, but they might not. And I think it is reassuring to Canadians that we can continue to move forward with democratic institutions in safe, socially distanced ways, through a lot more virtual contacts, through ensuring we're doing everything we can to keep Canadians safe and keep candidates safe, while at the same time reassuring people that even in the midst of a pandemic, our democracy is strong, our institutions are strong, and our capacity to adapt and continue to make sure that everyone has strong voices to speak up for them, particularly in this difficult time, is respected. There are 338 seats in that House of Commons, and every Canadian deserves to have someone out there fighting for them, particularly in this pandemic. And the people of Toronto Centre and York Centre certainly deserve to have their voice on the floor of the House of Commons in the coming months as we make difficult decisions to support Canadians through this difficult pandemic.
Thank you, Prime Minister. Prime Minister and Dr. Tam will now excuse themselves, but the ministers and Dr. New will be available for a few more questions. So just if we take a moment, and then we'll go back to the phone